Hello friends, my name is Valentina Monroy and today I am going to talk to you about the human spine. I'll tell you a little about its function and anatomy. Let's begin. Your spine is an important bone structure that supports your body and helps you walk, twist and move. Your spine is made up of vertebrae, bones, discs, joints, soft tissues, nerves, and your spinal cord. Exercises and strengthen the core muscles that support your spine and prevent back injuries and pain. Anatomy. Where is the spine located? Your spine is the long column of bones that extend from your neck to your lower back. Your spine starts at the base of your ischial head bone and ends of your tailbone and part of your pelvis, the large bony structure between your abdomen and legs. Vertebrae. The vertebral column or spine is defined as the bony structure that extends from the base of the occipital bone in the skull to the tip of the coccyx. Within the vertebral column lies the vertebral canal, which contains a cylindrical structure of nervous tissue, the spinal cord. How many vertebrae do we have? The spine consists of 30 vertebrae and total divided as follows: cervical vertebrae 7, thoracic vertebrae 12, lumbar vertebrae 5, sacrum 5 fused bones, coccyx or 4 fused bones. Typical vertebrae. No two vertebrae are identical. Vertebrae vary in size and characteristics, especially from one region to another. However, they all share the following basic structure. The vertebral body is the large cylindrical part located anteriorly that provides strength to the spine. It is responsible for supporting weight. Its size increases as it moves down the spine. Adjacent vertebral bodies are separated from each other by intervertebral discs. This is vertebrae, spinous process, vertebral foramen, pedicle, central depression, lamina. The vertebral arch is the structure located posterior to the vertebral body. It consists of two pedicles and two laminae. The pedicles contain the vertebral notches superior and inferior that form the intervertebral foramina. These foramina facilitate the passage of nerves from the spinal cord. The pedicles, lamina, and body of each vertebra from the vertebral foramen. The vertebral canal is the space extending along the spine from by the overlapping vertebral foramina. Vertebral processes. There are 7 in total, extending from the vertebral arch 1 spine process posterior inferior to transverse process posterolateral and for articular process. The latter contain the articular fascics. The vertebral processes also serve as attachment points for ligaments and back muscles. They also participate in the formation of joints. Cervical vertebrae. The 7 cervical vertebrae from the cervical spine in the neck. They are located between the skull and the thoracic vertebrae and have the smallest and thinnest intervertebral discs in the spine. However, they have the greatest range of motion of the entire vertebral column. In addition, the cervical vertebrae have distinctive first sacs at the transverse foramen, tuberculous anterior and posterior, and bifurcated spinous process. This image illustrates the anatomy of the cervical spine. The cervical vertebrae are typical. The atlas consists of 2 arches, anterior, posterior, and contains 2 lateral muscles. These muscles articulate with the occipital condyles of the skull, supporting its weight. The axis contains a vertical top-like protection, the dentate or odontoid process, and 2 superior articular facets. The vertebrae facilitate articulation with the atlas and aid in high rotation. The cervicoprominence has the longest spinous process. It is the most prominent bones at the backs of your neck. The remaining cervical vertebrae C3 and C6 are typical vertebrae. Thoracic vertebrae. The 12 thoracic vertebrae from the second region of the spine, the thoracic spine upper back. They play an important role in forming the thoracic cavity. The thoracic vertebrae have several distinctive features: costal fascics that articulated with the ribs, heart-shaped vertebral bodies, smaller vertebral foramina, and long, strong spinous and transverse processes that point downward. The first 41 to T4 and the last 49 to 12 thoracic vertebrae share some characteristics with those of the cervical and lumbar spine respectively. The 4 in between, the 5 to the 8, are typical thoracic vertebrae. The vertebral bodies contain thicker discs compared to those of the cervical spine. Lumbar vertebrae. The 5 lumbar vertebrae form the lumbar spine lower back. They have the largest vertebral bodies in the entire spine, which facilitated with bearing. The pedicles and laminae are thick and strong. Their spinous processes are short and sturdy to allow for the attachment of lumbar muscles. The lumbar spine also contains the mammillary and accessory process. L5 is the largest vertebrate in the human body. It supports and transmits body weight to the base of the sacrum. The spinal cord terminates at the conus medullaris at the level of the L1, L2. Sacrum. The sacrum consists sacrum consists of 5 fused sacral vertebrae. It is located between the lumbar spine, lumbosacral angle, and the coccyx and front part of the pelvis. Its main function is to transmit the weight of the upper body to the pelvis and then to the lower limbs. The sacrum has a base and apex, and the surfaces pelvic, posterior, and lateral. Located in its center is the sacral canal, a continuation of the vertebral canal. The sacral canal contains the cauda equina of the spinal cord. The sacral foramina anterior and posterior allow the spinal nerves to exit. The sacral crest medial, intermediate, and lateral represent the fused process of the sacral vertebrae. This is coccyx. Coccyx is about the leg time. You feel on your gluteus maximus. Dogs C20 are among the fewer you've seen about your coccyx, simply because it's incredibly painful. The coccyx articulates with the sacrum and consists of the 2/4 fused coccygeal vertebrae. It has two surfaces, pelvic and posterior short transverse process, and coccygeal horns. The coccyx is an attachment point for the gluteus maximus and coccygeus muscles. The filum terminale of the spinal cord terminates at the level of the first coccygeal vertebra, cord 1. Joints and ligaments. After learning about the vertebrae individually, it's time to explore how the spine is held together as a single structure. Adjacent vertebral bodies are joined by symphysis called intervertebral joints. The only exceptions are at the C1, C2 level and further down from S2 where there are no symphysis. Intervertebral discs are composed of the outer fibrous ring annulus fibrosus surrounding a nucleus pulpose. The function is to absorb impacts, prevent friction, and allow a degree of flexibility between the vertebrae. The lumbar spine is the most susceptible to developing herniated discs due to its location and its significant weight-bearing role. The bodies of the cervical vertebrae are also interconnected by anchored vertebral joints, the features of Luska. The vertebral bodies and intervertebral discs are reinforced by two fibrous longitudinal ligaments. The anterior longitudinal ligament runs along the anterolateral aspect of the vertebral bodies from the base of the skull to the sacrum. Its function is to limit extension and prevent hyperflexion of the spine. The posterior longitudinal ligament runs along the inside of the vertebral canal next to the posterior surface of the vertebral bodies from C2 to the sacrum. Its main function is to prevent posterior herniation of the intervertebral discs. Adjacent vertebral arches are connected by synovial joints called zygapophyseal facet joints. This front between the superior and inferior articulate facets. These joints facilitate flexion and extension of the cervical and thoracic spine. They also allow rotation movements in the thoracic spine. The vertebral arches are reinforced by several accessory ligaments. Ligaments flava connect iliac laminae and prevent separation during sudden flexion of the spine. Interspinous ligaments join spinous processes of the adjacent vertebrae. Nuchal ligament extends from the skull external occipital protuberance to the spinous processes of the seven vertex joints with the supraspinous ligament. Supraspinous ligament is the long and that connects the end of the spinous processes. Nuchal ligament extends from the skull external occipital protuberance to the spinous processes of the 6-7 hair joints with the supraspinous ligament. Supraspinous ligament is a long band that connects the end of the spinous process. This is the supraspinous ligament. There is a long band that connects the ends of the spinous process. Craniovertebral joints. There are two craniovertebral synovial joints from between the skull and the atypical vertebrae of the cervical spine, the atlanto-occipital and atlanto-axial joints. The atlanto-occipital joints are formed by the lateral muscles of the atlas C1 and the occipital condyles of the skull. They allow flexion, extension, and lateral tilting of the head. Thanks to these joints, nothing is possible. The atlanto-axial joints, two lateral and one median, are located between C1 and C2. This facilitates the pivoting movement. Is the head during and gestures of the disapproval. Nervous membranes and ligaments also connect the atlas, the ostics, and the cranium. The atlanto-occipital membranes, anterior and posterior, passes through the margins of the foramen magnum and the atlas, limiting the movements of the atlanto-occipital joints. The alar ligaments and tectorial membrane connect the axis to the occipital bone and the floor of the cranial cavity respectively. They prevent excessive rotation and the atlanto-axial joints, the cranium, atlas, and axis are interconnected by the cruciform ligament of the atlas. Costovertebral joints. The costovertebral synovial joints connect the the contortionists are missing a spine. The rest of the are definitely out of the capabilities and limitations of the our own spine. The spine is capable of the following movements: flexion, bending, forward extension, bending, back lateral flexion, right and left lateral extension, returning to the starting position after bending and rotation turning. All of these movements are influenced by the joints and ligaments already mentioned of the well as by the thoracic and back muscles. Movements in the cervical and lumbar regions of the spine have greater freedom than those in the thoracic and sacral regions. The adult back has four curves: cervical lordosis, posterior concavity, thoracic kyphosis, anterior concavity, lumbar lordosis, sacral kyphosis. Kyphosis refers to primary curvatures, whilst lordosis refers to secondary curvatures. The adult back has four curves: cervical lordosis, posterior concavity, thoracic kyphosis, anterior concavity, lumbar lordosis, sacral kyphosis, spinal flexion, flexion columnar vertebrae, sacral kyphosis. Kyphosis refers to primary curvatures, whilst lordosis refers to secondary curvatures. Vascularization and innervation. Blood flow to the spine is supplied by segmental arteries: posterior, intercostal, subcostal, lumbar, iliac, lumbar, and sacral arteries. In the cervical region, they derive from the vertebral and ascending cervical arteries, and the iliolumbar artery is branch of the internal iliac artery. As the segmental arteries follow the course of the vertebrae, they provide central branches to the vertebral bodies in the posterior arteries of the vertebral arch. At the level of the lamina spinal, branches travel to the intervertebral foramina, to the intervertebral canal, and the expliques the contents via the anterior and posterior arches of the vertebral canal. Venous blanks from the spine, they drain via spinal veins into the vertebral venous plexuses. The two vertebral venous plexuses drain into the intervertebral veins. This in turn drain into the vertebral and segmental veins of the neck and torso. The vertebral column is innervated by the meningeal branches of the spinal nerves. This divides into ascending and descending branches that innervate the vertebrae, vertebral discs, and ligaments. What are common conditions that affect the spine? Your spine plays an important role in your daily life. It takes a lot of work, and they're putting it at risk for damage and injuries. Common conditions that affect spine health include arthritis and arthritic conditions like ankylosing spondylitis, back strains and sprains, vertices such as spina bifida, bones spurs, curvatures of the spine, scoliosis, scoliosis and kyphosis, hernias discs. Waxes texture the heel of my spine. Other spine conditions include neuromuscular disease and myostrophic lateral sclerosis. Nerve injuries like spinal stenosis, sciatica, and pinched nerves. Osteoporosis, spinal cord injuries including spinal fractures and paralysis, spine tumors and cancer, spine infections like meningitis and osteomyelitis. What are common signs or symptoms of spine conditions? The most common symptom of a spine condition is back pain or neck pain. Up to 80% of Americans experience back pains at some point in their life. Other signs and symptoms of the spine conditions include muscles spasms, loss of bowel or the bladder control, weakness or the numbness in your limbs, arms and legs, paralysis. What checks the health of my spine? A healthcare provider may use the following tests to check the health of your spine: imaging tests, X-ray, CT scan, MRI, blood tests, electromyographic EMG, DEXA bone density test, spinal tap lumbar puncture. How are spine conditions treated? Treatment for each spine condition varies based on the type. Common treatments for spine conditions may include physical therapy, acupuncture, massage therapy, and chiropractic adjustments, medications, anti-inflammatories, muscles relaxants, etc. Injections, epidural, steroid injections, neural blocks, etc. Spine surgery, discectomy, foraminotomy, infection, etc. Important care. How can I keep my spine healthy? Strong back muscles can protect your spine and prevent spine conditions. Try to do back strengthening and stretching exercises at least twice each week. Exercises like planks strengthen your core, abdomen, side, and the back muscles to give your spine more support. Other protective measures include bending your knees and keeping your back straight when lifting items, maintaining a healthy weight. Using good posture, sitting and straight, not slouching. Talk to a healthcare provided about how to can keep your spine and other bones healthy. Thank you for watching this video about the human spine. In the next video, we'll talk about another topic in human anatomy. Bye bye.